Hello everyone, I hope you're all well. I've been back to work since last week, and tinnitus has been good, level 1 or 2. I think my eyesight is improving. Some of you would have seen in my last video but one, I'd had to start wearing reading glasses, but I think my eyesight is starting to improve again. Some days it feels like it is, other days it feels like it isn't. So I keep holding print back and forth in front of me. Sometimes I think it is improving, but then I think you're just focusing on it for so long now. You know, but it's difficult to say. But I think it is starting to improve, because I'm not having to wear my reading glasses as much as I thought I would have to, or was wearing them. So I think it is starting to improve. I hope it does. That was due to the gabapentin, of course. But generally, I've been back to a level 1 or 2 where I'm comfortable. Although today, at work, work reminded me why I don't like my job very much. And I did get irritated, and my tinnitus definitely went up. But I'm proving yet again that it's connected to my emotional state. Okay, but there you go. Generally, I'm a lot better. Like I say, this is going to be a Q&A, but before I get into the Q&A, I'm going to talk about something that's going to be quite controversial, and it's a treatment. Now, sometime in the near future, I mean, I've booked my plane tickets already, but in the near future, I'm going to be, myself and Amanda are going to be flying out to Florida. I've been on vacation in Florida before, and I love Florida. But while I'm in Florida, I am going to be visiting and meeting with a doctor who works in his own clinic in Florida. Now, this doctor, who I've been in contact with, and this is quite controversial, so I'm going to be careful in what I say here, and I am not, let me get this clear straight away, I am not advocating or putting this out there, what I'm going to be talking about. I'm not advocating or putting this out there as some kind of advertisement for this treatment. Okay, so I want to make that clear. Okay, but this is something I am going to be looking into while I'm in Florida. I'm going to meet with this doctor. Right, what is this doctor offering? I've been in contact with this doctor, and he performs a controversial treatment for tinnitus. And from what I've seen from his patients, it seems to work and have a high success rate. To what degree, you're asking? Right. It seems that all of his patients, at the very least, have a reduction or improvement in their tinnitus. But better than that, some of his patients, it seems, the tinnitus is reduced to a level where some of his patients after the treatment are saying they can't hear it anymore. Controversial, right? Yeah. Now, I've been in contact with this doctor, as I say, and I am going to meet with him. What is his treatment? The treatment that he performs, and I'm not going to get too technical about this or too detailed, because I only know what he has told me, and I only know from what I have seen. But the basis of the treatment that he offers is there is an area at the back of the skull, where the spine meets the skull, and his area of treatment is the COC1 and the COC2 joint of the spinal cord that meets the brainstem, the skull, where the main nervous system runs from down the bottom of the spine to the top of your head. And he treats the COC1 and the COC joints, that area round there. What exactly does he do? Right. Again, this is controversial. He has a form of medication which I'm not going to go into what it actually is because I don't want to get it wrong. I want to meet with him first. When I have met him, I will give you guys an update on how I found his treatment and did it work. Did it improve my tinnitus, or better still, has it reduced it to the point of where I'm not hearing it? I will let you guys know. But at this point I'm being cautious about what I say about it. When I spoke to this doctor, before I'd said anything, this doctor asked me, I'd explained to him, I'd said to him about how my belief in how I got my own tinnitus, about that I hadn't had any ear trauma, my hearing is fine, there's nothing wrong with my hearing, my TMJ joint is fine, I believe that I got it through high stress levels, too long periods of anger, you've heard me say all this before, and that it's a neurological problem in my brain that's causing me to hear this noise, and this is how I've approached it, in the way of calming it down and getting to the point where I can be at a level 1 or 2. And I also said to him that I'd had 3 days of entire silence, what I'm calling true silence and true peace. I know some people have asked me about this term I've used. That's how it feels, that's how what I'm going to call it, true peace, true silence. Whether the tinnitus was so far removed from my conscious thought I couldn't hear it, it was like I was pre-tinnitus. So for me that's good enough. Okay, but I have the condition still. You know, like I say, right now it's at a level 1 to 2, it's fine, I'm comfortable, but it is there. And I haven't had any moments of what I'm calling true peace or silence since those 3 days. Certainly not since I've had the gabapentin withdrawal. Anyway, I'm going off on a bit of a different subject there. Okay, this treatment. Yeah, before I'd said to him anything about, I'd spoken to him about why I thought I'd got it and this is my belief, and he was like, yes, okay, he goes along with it. But before I told him these facts, he said to me, have you had any automobile accidents or motorcycle accidents? I've had 3. And I've had 3 motorcycle accidents whereby it's been my neck that has suffered in the crash or crashes. I've been wearing a crash helmet, and although it's, you know, you get a severe bump on the head when you come off, it's been the neck that's been, you know, has taken the force of the impact. So he said to me, have you suffered any motorcycle accidents? And yes, I've suffered 3. Now why is this relevant? The doctor has said to me, and it's similar to the TMJ joint, why would this be a factor? He has said to me, with these accidents to your neck, these joints will have formed scar tissue around these joints and around the nervous system, the nerves in this area, and this will be a factor in triggering your tinnitus, and will be a factor in your tinnitus, and I can treat this and I can improve this for you. And the treatment is an injection of a medication into these joints that reduces and dissolves scar tissue around these joints. Why do I think that this will help me? Why do I think, or have decided, why have I decided to see this doctor? Well, this idea that he's put to me about his treatment ties in with when I have craniosacral therapy, which as you know I advocate, and I do advocate craniosacral therapy, I find it extremely helpful. It really helps me to relax, and it does feel like when my therapist is pushing points in this area, particularly in this area on the back of the head, these joints that this doctor is talking about, when my therapist is applying in the way that he does the pressure to these points, I get a lovely feeling of release, and this puts me into a state of relaxation. And the craniotherapists say this is a release of spinal fluid. Whatever it is, it has an effect. Whatever it is, it has an effect, and it's a lovely, calming, relaxing effect. And after craniosacral therapy, my tinnitus is always better. Plus, when Amanda massages these points on the back of my head, these joints here, exactly where this doctor is talking about that he treats, I get it helps. It's a nice feeling. It reduces the tinnitus. It does help, without question. So that kind of tied in, his treatment on these areas ties in with this area here in relation to my tinnitus. So I am going to visit this doctor, and I am going to try this treatment that he's offering, because I can, so I'm going to. Now, if it improves, reduces my tinnitus, great, wonderful. If it gets it down to a level where I'm not hearing it at all, you know, beyond a level 1, wonderful. What more is there to be said? What more is there to be said? If it doesn't work and it has no effect, I'm only back to where I am now. So I've got nothing to lose, you know, apart from the fee of the treatment itself, which I'm able to pay. Luckily for me, lucky me, I can do that. So I'm going to try it, and when I have, I will let you guys know how I found it and if there's any truth in it from my perspective. So watch this space. As I say, I'm not advocating this, and I am skeptical, but I'm going to try it, and I will let you guys know how I feel about it once I've had it and if it worked. So as I say, watch this space. It won't be for a little while yet, but I am going. Okay, so I just wanted to put that out there. And yeah, controversial, interesting, and we'll see. Right, going to do a bit of a Q&A now, because I've had a few questions from people. And the first one I've had was a YouTube question from Michael Havelach. And Michael Havelach has asked me, he's been struggling with his tinnitus for 6 months. He has ups and downs. He's also had craniosacral therapy for a few months, but he said his last session that he had, he seemed to find that it made it a bit worse. Have I ever experienced this? No. With craniosacral therapy, for me, I've never experienced it making my tinnitus worse, ever. And I've had a few sessions now. I've always found craniosacral therapy relaxing, and has always reduced my tinnitus in intensity and volume, and I've never found it's made it worse. Why do I think it could have made it worse? It's down to your therapist. You need to tell him if you found it's made it worse. You don't say whether it's the same therapist that you've been seeing or not. You just say the last session you had made it worse. Was this a different therapist? Because one thing with craniosacral therapy that I've found is you need to get to know your therapist, and your therapist needs to get to know you and what works for you. Like I say, with Rob Williamson, with me, he knows me now. He knows what areas have the most effect on me. It's this area at the back of the head, like I've been talking about. So he kind of concentrates on there, and that always makes me feel better. So why could it have made it worse? I don't know. It could be that the therapist is applying pressure to points that don't work for you. You need to tell them this, and so he can work with you to find out what works best for you. But no, I've never had it make my tinnitus worse. I've always found that it makes me feel better. And you've said here, my approach and the way that I'm coping with this inspires you, and you keep trying to improve it. That's great, good. That's why I'm doing this. I hope the videos help you. I hope they help you. So thank you for your question, Michael, but speak to your therapist and tell him that the last session that you had, you felt that it agitated the tinnitus, and he should be able to work with you and find what works for you. Right, the second question I've had was an email from Mohammed Yunus. And you said you've done all the medical tests at the hospital, and they say everything's okay. You've got it in both ears, it gets louder, and you said you're trying to take alternative medicine like shiatsu and homeopathic medication. Do I think these will help, and how long will it take to get? How long does it take to use it? I'm not quite sure what you mean now. I think what you're saying is how long will it take to work? Right, shiatsu, I don't know. I've never tried it. Shiatsu, I don't know enough about it. So I really couldn't answer your question on shiatsu. Try it. If it works for you and helps you, there's your answer. Try it. That's my advice on that one. I've never tried shiatsu. But try it and see if it works. If it works and it helps you and you're getting benefit from it, there's your answer. Go with it. Try it. Homeopathic. Okay, homeopathic remedies. My understanding of homeopathy and homeopathic remedies is the idea that a dilution of a substance or solution in water can enable the body to heal from certain conditions. Personally, I don't believe in homeopathy. No, I don't believe in it. That's my bottom line with homeopathy. I don't believe in homeopathic remedies as I understand them. Okay, as I understand them. As I understand homeopathy, it's a dilution of a substance or solution with water to some crazy figure. I think they worked it out that it was like a drop in the ocean. You know, a drop of the substance in the amount of water, like the ocean. You know, it all sounds a bit like a potion to me. So no, I don't believe in homeopathy, but that's only my personal opinion. It's just my personal opinion, but I don't believe in it. The same as I don't believe in Reiki either. Craniosacral therapy, yeah, absolutely believe in it. I've had Reiki, did nothing for me. I've seen other people have Reiki. One of my friends has Reiki, or had Reiki, and said that they got an amazing feeling from it. I'm dubious. I I've had Reiki performed on me, and no, I don't believe in that either. So there are things I don't believe in, but it's only my personal opinion. All right. So, but try this shiatsu, see if it works. Homeopathy, it's up to you. Try it. Sometimes I think the placebo effect, if it works, it's working. So, you know, that's my view on it. Placebos can work. Power of the mind. If the mind is making you feel like you're better, you're going to feel better. Okay, so placebos can help in that way, ironically. That's my take on that. And then I had a question from V2 Snow, YouTube question, and you've put, "Hey Adrian, I need help. I've had tinnitus since 2011, 2012, but you say that in August, and you've been okay, but it got worse due to a cold in August, and since then it's got worse, and the noise is so bad, you're hearing it above everything, like video games, movies, and talking with your friends. What can you do to reduce it?" What can you do to reduce it? Reduce it like now, because you're suffering, so you want instant relief. Right, if it's that bad at this time, and it's that loud, if it's that loud, my immediate thoughts are, just to get some relief for you quickly, would be to shroud it with white noise temporarily, just to get some relief from it. However, if it's that bad that you can hear it over video games and talking with your friends, I don't know if white noise is going to help you that much. But try white noise. I'm sure you may have probably done that already. Short fixes, quick relief. Like I say, white noise is what immediately springs to mind. But a quick fix, other than medication, which I don't like to advocate at all, particularly because of my recent experiences with medication. Unfortunately, or fortunately, depending on how you look at it, some medications do work, like gabapentin. They work and they do reduce it quickly, they did for me, but you run the risk of the severe side effects, so I don't like to advocate that. Depends how terrible you're suffering with it. The answer is, the good news is that you can get this to come down again. By what you've written, it sounds to me like you had a spike in August, and you've focused and continued to stay in this state of stress with this spike. You haven't allowed yourself to calm down, relax. This spike has happened and you've thought, God, I can't stand this, it's driving me crazy, and you've kind of stayed in that state of mind. And if you stay in that state of mind where you're in this constant state of mind of, this is awful, I need it gone, quick. Unfortunately, this will prolong the spike. This will prolong the volume and intensity of your tinnitus. So the good news is that you can get this intensity and volume to come down again, but the way you're going to do it ultimately is you're going to need to start to calm down and allow the mind to not focus on the noise, as difficult as this sounds. But long term, this is going to be the solution for you, is to calm down, allow your brain, your mind to realise that the noise you're hearing is not a threat. Your brain will reprioritise this noise once you start to calm down. Try and distract yourself away with it. I know you say you've been playing video games and things like that, but my suggestion is try try to do things like going for a walk in the park where there's the noise of birds or something like that, in the open, not playing video games. That's just my advice. But ultimately, the way you're going to help yourself to bring yourself back down where the tinnitus isn't at this volume and intensity really is going to be allowing yourself to calm down and relax, and allow your brain to realise that it doesn't need to listen to this noise or tune in to this, to your tinnitus. It doesn't, your brain does not need to tune in to the sound that you hear as your tinnitus, and that it can reprioritise it. It's not important, and put it into the background. That's ultimately how you're going to help to reduce your tinnitus, because there are no short-term quick fixes apart from shrouding it with white noise or medication, and I don't advocate the use of medication. That's my advice, is just start to relax, try and go out and relax. Let me know how you're doing, and yeah, let me know how you're doing. Try craniosacral therapy if you can find a therapist within your area. Try that. That I think will help you if you can find a good therapist. You will probably find, actually, with a craniosacral therapy session, if you get a good therapist, that you will find that will give you some instant relief to a degree. But ultimately, as I say, you're going to need to calm down and allow your nervous system to just relax, and your brain, your mind, will reprioritise this intensity that you're hearing with your tinnitus at the moment. That's my advice, but let me know how you're doing. Okay, I had a question from email. Email. I had an email from Pete again, and about craniosacral therapy, and you put, "Hi Aid, you say that craniosacral therapy works for you, but it's expensive." And yeah, it's expensive. Do I think that acupuncture would be as good as craniosacral therapy? Acupuncture. Okay, acupuncture. After having said that I don't believe in homeopathy, acupuncture is something I do believe in. I've had acupuncture. I had acupuncture for a shoulder injury from a motorcycle crash. I don't know if you've seen on some of my videos where I'm in one of my vest tops. I've got a scar that runs from there down to there. That was from a motorcycle accident, and I smashed all the deltoid muscle on that side of my shoulder there. All the deltoid muscle got smashed. And I had to have a metal plate in there for 6 months, and it was pretty rotten. And part of my treatment was acupuncture, and I can honestly say that for my shoulder injury, it definitely helped. How it works, don't know yet again. Something to do with the nervous system in a similar way to craniosacral therapy, but for that it worked. For tinnitus, I had acupuncture. I tried it because I'd previously had this injury and it worked for that, so I thought I'd try it. So I tried acupuncture, and for my tinnitus, there was little or no effect on the volume or intensity of my tinnitus. The acupuncture did not impact on my tinnitus, or it didn't impact to a degree where it was noticeable for me to return to have more sessions. But it may work for you, Pete. I do think acupuncture can work for certain things. Again, my advice is, if you can't afford craniosacral therapy, then yeah, try acupuncture and see if it works. If it works, great, continue with it. For tinnitus, for me, it didn't work, but I do believe acupuncture can work. So try it, Pete, see how you get on. You haven't told me how you're getting on with your audio device, Pete. I know you said that you were getting one, you're going to try it, so let me know how you're getting on with that, because I haven't heard from you about the audio device, so let me know. And the last question is from your emails always make me laugh. Hound is from Hound, the Hound, and you've put Aid, tinnitus is doing my nutting. What do I suggest to bring it down? Yeah, tinnitus is doing your nutting. What do I suggest to bring it down? All the things that I've just mentioned in all the other questions, Hound, try them. And you don't say what you've tried or are trying. Your emails are quite short. I need a little bit more from you. So try all the things that I say in my videos: craniosacral therapy, Tai Chi, meditation. I don't know if you've been doing any of them. Try all of those things, and the things that I've mentioned with the previous questions. Try them all, let me know how you get on. And you've also put, what headlight did I stick on my bike? Right. Yeah, I've got a lovely little retro headlight for the bike now. It looks much better than that futuristic gizmo that was on there. So it's an old retro looking headlight. It looks pretty cool on the bike. Yeah, I will be doing another bike video later on, just to show my fellow biker subscribers out there where I am with the with Misdemeanor. That's the name of the bike, Misdemeanor. So I'll do a little video just for you biker subs out there and show you how I'm getting on with it. Alright, so I think that's it for this video. Best wishes to you all, and I hope to speak to you all again soon in my next video. Thanks very much. Bye bye.